Welcome to another SourceViews Talking Out Clouds, our leadership chat series. My name is Liz Grint, Marketing Manager at SourceViews. And for those still unfamiliar with SourceViews, we're a strategic digital transformation company, which for over 17 years now has been helping businesses evolve through cloud-native technologies. And with that in mind, today we're going to hear the inspiring story behind a novel application used in the field of dentistry, how the idea first took shape, and how engaging with different partners and third parties helped bring that vision to life. So my guest today is the CEO of Oral Genome, a recognized expert and influencer in the dental industry with a passion for out-of-the-box thinking, and that is Dr. Tina Saw. Welcome, Tina.
Hi, thank you so much, Liz, for having me on your podcast.
It's great to have you here, Tina. I know you're a very busy woman. But perhaps we could start by briefly describing your background and experience for the audience, especially when it comes to your passion for entrepreneurship related to oral systemic health.
I'll give you a little background. My name is Dr. Tina Saw, and I'm from Carlsbad, California. For people who don't know where Carlsbad is, that is in North San Diego. My passion for entrepreneurship probably came during the COVID-19 pandemic. At that time, I had been practicing quite a bit of time as a private practice owner in my own place, and I saw many, many patients. And when we were closed for COVID-19 temporarily because nobody knew about aerosols and how contagious things were with COVID, I had a lot of time to just self-reflect and think about all my patients, what they were asking, the needs that they had. And then I started getting like the entrepreneurial bug, which I feel like has now become a disease today for me. But that's just a little background of kind of my experience.
That's great. I didn't know that a disease existed, but it sounds like a positive one. Um, so,
Yes.
uh, Tina, how did your idea first originate for a dental saliva analysis application? What was your objective?
Well, I was like pretty frustrated as a dentist because I always felt like I was fixing teeth. And when I went into dental school, like for my interview, and when I went in, and the reason why I went into dentistry is because I really wanted to help people. I wanted to get people on a good and healthy smile, really focus on prevention. I also knew there was a lot of connections between oral systemic health. So what can we do if everything diseases start in the mouth? How can we really educate people on being really healthy in their mouth first? And so as I started going into private practice, I quickly realized that I was always going in to look at the x-rays. I did a clinical exam and said, oh, you have a cavity here and here. We see a hole in your teeth. You'll need a crown so that we can patch the hole up. And by then it was too late. There wasn't any magic wand that I could do to wave to get rid of these problems, because once the hole was there and once the disease was there, it was a little too late. And on the flip side of it, I had a lot of frustrated patients, and it was very common for them to come in because, I don't think anybody intends to have like a dental disease, but it just happens. And a lot of it has to do with education. And patients would ask, like, why? Why me? Why did I get this? Like, why? I mean, I don't understand. Like, I've been eating healthy, or I eat less candy and sugar. I still don't understand why. And so part of the thing with it too is we were fixers all the time. I was always putting a drill in somebody's mouth. And then I started going to home improvement stores like Home Depot and Lowe's, just because like I needed some work done in my house. And I was like, oh my gosh, these burrs look like giant versions of the dental stuff. And then I was like, we literally are just teeth carpenters. In general, I think dentists, we go into the profession to help people, but we end up doing a lot of fixing. Patients go to the dentist asking for prevention. They want that relationship with their provider. They're always asking for guidance, but if we can't really identify what's going on in the saliva or the root cause, we can't really truly help our patients. We're essentially just guessing and going into a blind box and thinking like maybe this will work.
I love that feeling that like you want to get back to the root cause, not always treating
Yeah.
the symptoms or dealing with the symptoms. So you had this idea for point of care testing. You knew what your goals might want to be, but what were your next steps in making that vision for a solution a reality?
Yeah, so for me it was always like finding the right people. I think, when you go and become a dentist and you're trained and okay, I know how to do restorative, these fillings and things, but this was something that was pretty novel and I had to find the right people outside of dentistry. So I started looking at like technologies outside. I started asking around and I found enough people where I connected them on what I wanted to do. They believed in it. And I said, come join me in making this happen. And that's kind of how I started making it into a reality.
That's wonderful. And also, I hear congratulations are in order because I understand that you won the AWS Health Equity Initiative. So I understand that's a program that's led by the AWS Global Social Impact Team, and they're trying to support the development of culturally responsive solutions. That's quite a mouthful, but how has it been working with AWS?
Yeah, it's like a huge honor too, because when we won that award in the initiative, I was like definitely a little floored because I always saw myself as just a little dentist wanting to make an impact on my community because I saw these problems that was happening. So it's definitely a huge honor that we have been recognized by AWS for making such an impact, especially in the rural underserved communities. And there's so many communities out there right now that have a shortage of providers, and the wait times to go see a dentist is over a year. We did a lot of research and mystery shopper just to kind of find out, okay, what are the frustrations of patients in these communities? And a lot of them is, I simply just can't get in. And so we're really excited about what Oral Genome does and what we're doing, which is tapping into the prevention visit in the home at the local community center. So we're really delivering care at a site where, that they can easily access. And it doesn't require a dentist to actually go and administer the tests. So we're really grateful for not only AWS, but also those other health equity partners and the community centers that we really partner with to help us deliver more care and more access points for patients. And I think back to how I got connected back to AWS, and you asked me about, finding the right people on the team. And I was at that point early on in this startup journey where I was just reaching out and seeing if anybody would believe in this vision. And sure enough, AWS was one of them. And they helped me find the right team, the right technology partners, and who believed in what we were doing and was there to support. And, SourceViews is actually one of them.
Well, that's a really good segue because I was going to ask you, because we're an AWS partner, what was it about SourceViews that made developing your mobile app feel like a good fit for Oral Genome?
Yeah, I mean, it's communication. Like I'm all about open communication with everybody. I mean, I'm sure there's talented people that will go do their job and then the project will come back. But for me, what really, really drew me into SourceViews was I think we have meetings twice a week for half an hour just to check in. But not only that, there are things with SourceViews. I mean, even though we have two scheduled meetings, I think I talk to SourceViews about every single day because they've been really great about like if we've had to make pivots, they went and helped us make those pivots, troubleshoot different things. The other thing that was really good for me was SourceViews, and the reason why we were recommended by AWS is we work with patients, and HIPAA compliance is really, really critical. There's no data breach or anything, and so SourceViews was one of those things where you guys had the AWS healthcare and SaaS competencies that we needed so that we could assure all our partners that we were keeping everybody safe.
That's really great. So look, tell us a bit more about this new mobile app, what features it includes, how is it benefiting both your business and your patients now?
So our mobile app, we are, MVP, which is what SourceViews has built for us, which is if MVP, if you don't know, is minimum viable product. And what we've been I would say it's probably beyond MVP at this point. But what our mobile app does is once you download the app, you're going to register as a caretaker or a patient, but it's really just one profile. It's built almost hybrid so that you can, if it's a caretaker, they can see all the people in the home. If it's a dental office or a provider, they can see all their patients. If it's a mom, they can see their all their children under this app. But once you get in the app, and we have different profiles for everybody, go through all the questions, like the healthcare questions, and then you go in and do the testing. I mean, our testing is so easy to do. We have a QR code on our box, and after you scan the QR code, you're downloading the app, but then you're entering the test kit ID in there, which is going to help us and our computer vision team to really identify the calibration curve so that all the testing is really accurate. What I love about our mobile app is that it walks through every single patient, like exactly how to do the test. We want it to be anybody, any untrained user, anybody can actually go and do the test simply. So with SourceViews, we actually worked really extensively with the user experience portion of it because we want we don't want people to be frustrated doing the test. And yeah, so after doing the test and getting the mobile app to walk you through, you're going to essentially take a snapshot, a photo of your test card, similar to how you would do a mobile check deposit. Then it's going to send to our computer vision to read, and you're going to get the results and recommendations right about immediately about your dental health. And then you can, share it with your provider, or if they don't have access to it, or read it on your own leisure.
Well, it sounds amazing, Tina. And, it's just great that it is all coming to life. Now, you're not only the CEO at Oral Genome, you've also had to be the project manager for the entire process. So what would be your one piece of advice to other entrepreneurs like yourself on how to handle working with different technology partners, scientific teams, and third parties? Third parties.
Yeah, I mean, I think when you are the CEO and you're in a startup, you have to learn to wear multiple hats. And yeah, I have been the project manager for the past couple of years. And it's really important to kind of have some of that oversight to know, like, okay, this is what my scientific team is doing. This is my technology partner is doing. This is what my design team is doing, because in the end, it all falls onto your shoulders to put it all together. So now we're at this really exciting point in the journey where, we're deploying the product, but now we have multiple scientific teams and technology partners, and everybody is coming together to actually put the final product to life.
And lastly, Tina, I have to ask, what was your experience like working with the SourceViews team?
My experience with the SourceViews team has been lovely and wonderful, and I I just really feel like they're actually part of Oral Genome and exactly what we do. I feel like they've really given us a lot of attention, and they're really part of like knowing, okay, we are under the pressure because we're working with this external partner who wants to do the tests. We need you to deliver by this time. And they've been very on top of everything. Yeah. So I feel like I'm stressed, but they're also stressed for me. And so it really is nice to have a partner like SourceViews being in it with you and feeling like, they're very much part of the team and cheering you on.
Yeah, walking step by step.
Yeah.
So, Tina, you're a real inspiration and you're a very, very busy person. So I want to say a huge thank you for joining me today.
Yes, thank you so much for having me. And we're really excited for everything. And yeah.
Thanks, Tina. And thanks as well as always to our audience for watching. Add your comments below to the video, like the video, and subscribe to our YouTube channel so that you're notified each time we post a new video. Join us again soon when we'll be back with another Talking Out Cloud.